Hello everyone, welcome to our first webinar. My name is Michael, and in a few moments I will be passing you over to today's presenter, Helen, to talk to you about our medical improvement program. But first, a little bit of housekeeping. The webinar is designed for people with knowledge in giving medicines and to help you further understand your role. So this might be a little more in depth if you don't already have any medicines training, I should say. If you have any questions throughout the webinar, please use the Q&A feature provided. We will get to them at the end due to the amount of delay there is between us and you. But for now, I will pass you over to Helen, who will talk a little bit about herself to you.
Hi, and thank you for joining the webinar today. If you don't already know me, I've worked for PrimeLife for nearly 4 years, and I'm involved in everything medication-wise, including developing new training packages, audits and email. Previously to my joining PrimeLife, I've worked for several pharmacies supporting care homes all over the country. I think of myself as a people person, and I hope you find this webinar a really useful support tool. So let's begin. Today we'll be looking at medications for dementia. We will be looking at the generic name and the brand name for these medications. And it's important that you know both, as this can often lead to duplicates on the MAR chart and the medication being given twice by accident. Sometimes it's easier to pronounce the brand name than the generic name. So, medications prescribed for dementia. There is currently no cure for dementia. In fact, because dementia is caused by different diseases, it is unlikely that there will be a single cure for dementia. Research is aimed at finding cures for dementia-causing diseases such as Alzheimer's disease, frontotemporal dementia and dementia with Lewy bodies. Cognitive symptoms experienced by dementia residents will vary from resident to resident depending on the part of the brain affected. However, the most common symptoms are memory loss, forgetting everyday objects, losing the ability to talk, problems with thinking and resolving problems, and being confused. So, medications licensed for Alzheimer's. Let's look at the common medications currently licensed for Alzheimer's. However, they are used for dementia with Lewy bodies, including dementia associated with Parkinson's disease. Donepezil, galantamine and rivastigmine may help to improve the side effects of hallucinations, sleeplessness and confusion with residents with Lewy bodies and dementia. Memantine can be prescribed if the resident does not tolerate the above. Common medications. Memantine. This is available in tablet and liquid form and treats moderate to severe Alzheimer's. An oral syringe should be used for measuring this medication when in a liquid form. The recommended starting dose of memantine is 5 milligrams taken by mouth every day. The doses should be increased by 5 milligrams every week to a target dose of 10 milligrams twice daily. The doctor will give you patient-centered advice on this. Memantine was able to delay the worsening of cognitive performance over a period of 6 months in about 1 out of 10 people. The studies also suggest that it can relieve severe restlessness. Donepezil. You may recognise this as the brand name of Aricept. Available in tablet or liquid form, an oral syringe should be used for measuring this medication when it's administered as a liquid. It is taken at night because it can cause irregular or slow heartbeat for some residents, which can cause fainting. When taken at bedtime, residents are able to sleep through this and therefore reducing the risk of falls. Donepezil is used to treat some types of Alzheimer's, Parkinson's and dementia with Lewy bodies, and to treat dementia related to Alzheimer's disease. However, it does not cure Alzheimer's disease, but it may improve memory, awareness, and the ability to function. This medication is an enzyme blocker that works by restoring the balance of the natural substances called neurotransmitters in the brain. It can also help with mixed dementia. This medication does not work straight away, and it may take several months for the benefits to show. Memory and other brain functions may improve over several weeks. In some residents, symptoms may not improve, but progression of the disease may be slowed down. Donepezil also has antidepressant-like properties. Galantamine. You may recognise this as the brand name of Reminol. It's available in capsules, tablet, and liquid form. This is prescribed for mild Alzheimer's and can be taken as a combination therapy. It's often prescribed as a slow-release tablet. Slow-release medications release consistent amounts of the drug over a long period, so the resident does not need to medicate so frequently. An oral syringe should be used for administering this medication when given as a liquid. Galantamine will not cure Alzheimer's disease, and it will not stop the disease from getting worse. In Alzheimer's disease, many chemical changes take place in the brain. Galantamine does not work straight away, and it may take several days or even weeks for some symptoms to improve. Memory and other brain functions may slowly improve over several weeks. In some residents, symptoms may not improve, but the progress of the disease may be slowed down. Rivastigmine. You may recognise this as Alzheimer's Patches or Elexon oral solution. It's available in capsules, liquid, and patch form. This medication is used to treat mild to moderate Alzheimer's. Patches should be applied to a dry, clean, hairless part of the body, usually the back, arm or chest, and old patches should be removed before applying a new patch. It is good practice to apply the patch at the same time each day, and the patch should be applied to a new site each time, and that site should not be used again for 14 days. Ensure there is a patch chart available as well as a MAR chart for recording the administration. This medication may cause nausea, vomiting, diarrhea, stomach pain, loss of appetite, and weight loss. Report to your manager and doctor if any of these problems are severe, because they could cause other health problems such as dehydration. Again, this medication does not work straight away. It may take several days or even weeks for benefits to show. Memory and other brain functions may slowly improve over several weeks. In some residents, symptoms may not improve, but the disease may be slowed down. Things to think about. Sometimes residents with dementia refuse to take their prescribed medication. Every resident has the right to refuse their medication. It is important to understand why. It could be because the medication is hard to swallow, it tastes unpleasant, or causes side effects such as nausea. This is often why it's prescribed in a patch or liquid form. Think about your PBS training when administering medication. You can usually tell from the resident's reaction that they dislike the taste or that the drugs cause unpleasant side effects. Contact the GP for advice on alternatives. There are times when the resident is more comfortable taking the medication in a particular setting or with the help of a certain member of staff. Think about your dignity and respect training when administering medications. If the resident refuses the medication, we can offer the medication later, but this must be documented with the exact time on the MAR chart and does not apply to time-critical medications. Do not be tempted to try hiding medication in food. Medication that is hidden in food is called covert medication and needs to be approved and have written consent in place. This should be documented in the care plan and documented on the MAR chart. Think about your MCA and dose training when administering medications. Does the resident have the capacity to refuse to take their medication? If they refuse, try again later. Remember to document and report all non-administered medications and inform the manager if the medication is refused throughout the day. Talk calmly to the resident, explaining the importance of taking the medication and how it will help them before documenting it as refused. Remember, documenting all non-administered medications on the MAR chart is just as important as documenting when a medication is given. Document the reason for refusal on the MAR chart, as this could be important later. Always remember to clean your hands before and after administering any medications and use the appropriate PPE. Remember to clean the medication trolley before and after each medication round, and remember to restock the trolley with clean medipots, giving spoons and syringes. Think about your infection control training when administering medications. Medication side effects. All medications have side effects including nausea, vomiting, headache, dizziness and rashes. To find out more about medication, always check the patient information leaflet in the medication box or look up the medication in the BNF book or online at the EMC website for all side effects, dosage information and overall advice. Remember to monitor the resident for any changes or reactions that may be caused by the medication and report your concerns to your manager. Always inform the supplying doctor or pharmacist if the resident is taking any other medication, including herbal medications, vitamins or supplements, cold and flu preparations, and remember, this must all be documented on the MAR chart. Thank you. Is there any other questions for us?
Okay, Helen. First question. What happens if a resident goes without medication that are prescribed to prolong the symptoms or the effects of dementia? What happens if they miss out on medication?
Well, obviously we should have documented this. We should try to encourage the resident to have this medication. If they go without it, then obviously they will probably become more restless, more anxious. As I say, there's no cure for dementia, but the side effects of not taking the medication, you will see a deterioration in the resident.
Yeah. It was like that when we went, wasn't it? I think they were entertaining them.
Should I be wearing gloves when I apply the patches?
No, we don't apply patches wearing gloves because the patches can often stick to the gloves. So yeah, bare, clean hands for applying patches.
Why would we use syringes over the medication pots that are given with the medication?
Sure. We use syringes as this is a more accurate way of measuring medication. Now, for things like lactulose, Gaviscon, those sort of products, we would recommend using a Medipot because the medication is too thick. When you're measuring out something for dementia, it's really important that we get an accurate reading, and the only way we can do this is by measuring with an oral syringe.
Okay. And the last question we have at the moment, can a client be prescribed more than one type of medication to slow down the effects of dementia?
Yes, they can, but this obviously would be discussed with the GP. So they can have combination therapy for their dementia.
Okay. Well, we've not got any more coming through at the moment, so
okay.
let's just say thank you very much everybody for watching. If you have any other questions, you can reach out. Helen, what's the best way for them to contact you?
Okay, sure. I can be contacted on Helen Berridge at prime-life.co.uk, or you can always call my mobile. It's 0791 704 5483. Thank you.
Okay. Brilliant. Thank you very much for everyone who taking part today, and hopefully we'll see you again in 2 weeks for our next webinar. Goodbye now.
Thank you. Bye.